And Joy, if you can, just wave your hand, so I'll shake your head. I thank you for letting me be here this morning. It's always a pleasure to speak to someone, especially that's willing to get up on a Saturday morning and listen to a foreign politician. So I want to try to keep this kind of friendly this morning. I'm sitting at my kitchen counter, and I hope the video's okay. I could use a phone and you could get a little better, but this seems to work fairly good. And I want to keep this to the point that you can ask questions at any time if you have a question about what we do at the Department of Insurance, and try to address some of the things that are of interest to you. We always continue to do what we think is in the best interest of the state of Mississippi citizens. Our office tries to be a regulator that is nonpartisan in the way that we regulate. And I think our 13-year history at the department has been that way. So, and Lynn, I hope you would agree with that. So I've known Lynn Evans a long time. We handle about between 12 to 15,000 phone calls each year at the department. And we have more than 1,000 written complaints that come into the department every year. The number of complaints that we're having now are considerably down from where they were a decade ago, let's just put it that way. So we seem to be making some progress in improving claims and not having the complaints that we used to have. You'll always have complaints when you have catastrophic events like tornadoes or another hurricane on the Gulf Coast or a Katrina event. And that's usually because of misunderstandings, but those are kind of down to a very small amount considering the number of claims that we handle. As an example, we had two tornado events within 2 weeks down in the southern part of the state around Collins and Brassfield and Purvis, Mississippi. And of all those claims, I think that we may have had 30 to 35 complaints, and most of them were about roof damages. And you'd be surprised, that's usually where most of our complaints are, what happens with the roof. So to move that forward, on the Gulf Coast, after Hurricane Sally came through and then Zeta, we had just 21,000 claims on roof damage. Most of those were with the windpool, which although I'm not on the board, I have to regulate the windpool, which is a semi-state run insurer of last resort for the Gulf Coast for wind and hail. But we had addressed some of those issues that we thought would come up several years ago. And as a regulator, you have to do things that a lot of people don't like. And we forced the windpool to try to give some money back to the consumers if they had roof damage. So it's been a challenge for us. This is the first real test to see if what we ask them to do is actually working. And you'll find that a lot of the problems are usually with the adjusters that come in from outside the state that look at a claim and decide, well, you know, I don't see how that could be storm surge or that storm surge when you don't have any water that's moved on shore. So we had a lot of claims and complaints about storm surge that did not happen. And we've used a lot of new technology thanks to Roger Wicker's efforts in the US Senate, where we can use satellite video and satellite telemetry and infrared cameras and just a whole host and a myriad of things that will help us to determine whether or not we had wind speeds that were exceeded 110 miles an hour or actual flooding. So we've been able to work through most of that. Very quickly, I noticed that someone asked earlier about the legislative issues and where do you go if you want to look up a bill status. It's www.legislature.ms.gov or ls.ms.gov. It'll take you to the site, and Rim's on here, so he can explain that a little farther if you need help. And when you do a bill status, you have to put in whether it's an HB, that's a House bill, or an SB for a Senate bill. But it's pretty well self-explanatory. I would encourage you to watch the webcast. There are usually about a 30-second to a 40-second delay in what's actually happening, but you kind of get an idea of what goes on. And the Lieutenant Governor has given you another avenue to look at what goes on in the Senate with more meeting rooms that have video cameras and recordings of what actually goes on in the committee process. And I think that will help you a great deal if you're trying to figure out what goes on there. This past year, we had some bills that came up that were not actually bills that we wanted to introduce, but were introduced, and we just kind of took them over and said, you know, these are pretty good pieces of legislation. And one of those was House Bill 95, which authorized the Commissioner of Insurance, whether it's me or whoever follows me, to resolve disputes between healthcare providers and citizens who have policies. And a lot of times someone will go to an emergency room or to a healthcare provider, assign the insurance, and they pay the deductible and out-of-pocket expense. And then 2 or 3 weeks later, they will get what we call a surprise bill from either the emergency room attending physician or someone else for anywhere from $4,000 to $5,000. And we had many cases like that. And we intervene if a consumer calls and asks us, we'll intervene. We don't voluntarily do it, but if they ask us, we will help them. And in every case that we've had to intervene on an assignment of benefits, we've won. And to carry that forward to let you understand why it's so significant, we had a lot of air ambulances that would go in and listen to the radio traffic in case there was a wreck, and they would send an air ambulance out to where the wreck was located, pick the patient up, take them to a hospital, say it was in Brookhaven, and it would be 15 miles away, and the patient would get a $50,000 or $60,000 bill a month later for that air transportation. I took the position as commissioner that you couldn't do this. This was several years ago because you had a medical provider on board, and that would be a nurse practitioner or a nurse, and you performed a medical service, so you were limited by the assignment of benefits if that person had insurance. We have won every case where we've had overcharges of $40,000 to $50,000. And I think a good example would be one where we had a state employee at Whitfield who was an attorney, and they thought she was having a heart attack, and the air ambulance went and picked her up, took her to the hospital in Jackson, which is a 12-mile flight. And the state health plan paid $18,000 for that air flight. 2 weeks after she was in the hospital, and by the way, she did very well, she survived, she got another bill for $22,000 from the air ambulance provider, and we were able to adjudicate that and get it thrown out. But the bottom line was it helped us work with UMMC to work out some of the kinks in their ambulance service, and I'll have to commend UMMC for working with us. That's the type of things that we do. You never see that in the newspaper. You don't see a lot of media about it, but HB 95 gave us more teeth to negotiate this balance bill and to provide penalties against the healthcare provider and the insurer if they don't pay the bill properly. We also had a bill 1253 that designated the State Fire Academy, of which I am responsible for. The Fire Academy is a secondary agency under the Department of Insurance that we manage, and we train about 16,000 people there each year. Mostly are professional firefighters and volunteer firefighters. What we are doing now are training EMTs, emergency medical technicians, and emergency medical responders, so that when a first responder goes out on a call, whether it be a fire call or a wreck on the interstate, and that's usually the local fire department that handles those, that they're trained as to what they need to do. So when they get the patient to the hospital, they have a better chance of surviving if they're injured. That's a big deal. The community colleges were first against the Fire Academy training emergency medical responders, but they capitulated. They're on our side, and they've just given us a $500,000 grant to train more first responders, and we're working hand in hand now with the community colleges. I just say that to say it's amazing what you can do when you have free flow of communication and agencies work together. You can really make a difference. The more that you have in the government process, the better your government works to provide those services that normally citizens couldn't do. That's just a sideline. That's something I personally believe in, that you really need to communicate. We did do some things that were pretty important to the consumers in the state right after the pandemic started back in late February and early March. We saw immediately that older patients were going to have a problem if they had to go into a doctor that they could probably catch COVID-19 if they weren't careful. So I called my staff together and we issued our first bulletin for the year of 2020. It's 2020-1 if you want to look this up on our website. And this bulletin basically addressed telemedicine, and it said that healthcare providers, that's doctors and hospitals, could provide telemedicine using not just video and audio, but audio only in some cases. And that's specifically for doctors that had longtime patients for 10 or 20 years, and they knew who they were, and they could call in to get their prescriptions refilled without having to go to the doctor's office. It proved to be a godsend in the long run because not only has it saved the money, it saved a lot of lives and helped a lot of folks, but we had some carriers, and specifically Blue Cross Blue Shield, that said they wouldn't comply to the bulletin, and this was in early March. So I basically took a pretty hard line approach and said, you either will comply or I'll get a restraining order from the federal courts, which we could do, to make you comply. And it took about an hour or so. They complied, and the reason they didn't want to comply was over mental health. And I'm a big believer in mental health parity. We put that into our platform back when the Affordable Care Act was passed. If you have stable mental patients, you have a stable workforce. And we found that telemedicine worked quite well in addressing some of the mental health issues that we have in the state. So that's all seems to be working. And to carry that forward to where we are today, the State Medical Association has introduced a bill to make our telemedicine bulletin permanent. We normally issue bulletins only under the executive order of what happens in a catastrophic event. In this case, we issued that bulletin based upon the governor's executive order concerning the pandemic and COVID-19. So the State Medical Association wanted to make the bulletin permanent and statutory law. We helped rewrite that bill, and if you want to look at it, it is now on the website. On the Senate side, you can look it up and read it. It's fairly simple. It's not rocket science. It just says that healthcare providers must have some way to provide telemedicine and reimburse the physician or the healthcare provider for their services. And there are arguments on each side. They're kind of long to get into here, but they're simple as the hospital would say, well, the doctor doesn't have an office that he has to pay for, and we said that's maybe true in some cases, but in most cases, they do have a doctor. They still have to work on schedule, and when we looked at all of it, we kept the reimbursement rates, and it's something called coding, where the codes would be correct, and the healthcare provider or the other healthcare providers that are providing medicine without mental health and what I would call psychiatric evaluations can get paid also. So that's some of the things that we've done. On the Affordable Care Act side, we have about 100,000 people that had signed up for the Affordable Care Act beginning in January. Actually, a little over 100,000 that were signed up during the month of January to begin coverage in February. And after that, the enrollment periods are closed. So we have 2 carriers in the state this year. Centene through Ambetter is still a carrier in all 82 counties. They've been here for since the inception of the ACA. And we have Molina as a carrier in all 82 counties. Molina is one of the new carriers that were recruited to come into Mississippi. And they also are providing services under the CAN program for the Department of Medicaid through the state. Now, the normal question that a lot of folks would ask me about, what about Medicaid expansion? That's usually not something that's in my bailiwick, so to speak, but we do have plans to expand Medicaid if we had to on one side without having to go through the executive branch. If the Biden administration were elected, we had another plan if the Biden administration were elected, and we had a bifurcated Congress where we had the Republicans controlling the Senate, the Democrats on the House side, and then we have a plan for what we should do under the Biden administration with the Democrats controlling both bodies. So we're kind of prepared as to what we have to do at the department to provide insurance to the citizens, and how we would be regulators depending upon what happens after the 20th of January. So that's kind of an answer of where we are. It's kind of tricky for me to talk about Medicaid expansion when that's not something I handle. And we've had the previous governor and the present governor and a lot of the other elected officials saying they don't want to expand Medicaid because they don't trust the federal government. All I can say is it's pretty evident. It's not something that we pull a number out of there and would say. We can unequivocally quantify that we have left over $6 billion on the table that could have been used for healthcare in the state. My concern outside of insurance is that we have 30 to 35 hospitals in the state that would probably close if they do not have an income stream. And you don't have an income stream when you have 300,000 to 400,000 people uninsured that depend upon these hospitals for healthcare. So it's a chicken and an egg deal with us. You've got to have both of them to work. You've got to have hospitals, you got to have healthcare providers, and you got to have bona fide insurance that's affordable, or you got to have Medicaid coverage to try to keep these hospitals and healthcare providers in business in the rural parts of our state. So that's always a big issue. I just don't see anything happening this year, although this is the year for the renewal of the Medicaid statutory law. So I don't know what will happen. I try to stay out of the Medicaid business, but I've got to be prepared for whatever happens on each side. So that kind of gives you an idea of what we do. I did hire another new attorney yesterday to work in our healthcare side that will do the research as to where we need to be going. And the reason for that is we can't get approval from the President Attorney General to hire outside resources. We can get approval from the feds to hire outside resources to do research and work through our attorneys that we have in our office. So there are a lot of issues internally that we have to deal with. Most of them end up being politics, and that's a tough road for us sometimes. So that's kind of where we are. I could talk all day about the coronavirus. We've been involved in a lot of the planning for the coronavirus. I'm not on the team, the task force for the coronavirus. Wasn't asked to be on it, didn't want to be on it. I have enough to do as we try to run the insurance department. But I do have 16,000 plus firefighters in the state that have not been vaccinated, and that includes the people that are on ambulances and go out to save people's lives and property. And it makes it pretty tough for us when we end up with a lot of volunteers who do not get paid, that risk their life on a daily basis to save someone they may not know, and they can't get vaccinated. It's just kind of crazy. And we have been on the list. I think we're in category 1A, B, which is for people 65 and older and first responders. But I didn't add that not only do the 16,000 firefighters qualify as first responders, but we've got about another 20,000 law enforcement agency people that qualify. And some of them have been vaccinated simply because they were in a different category from a firefighter. I don't know what will happen or whether or not we have enough vaccines in the state. I'm not privy to some of the vaccine counts, but I do know that there's been a lot of communication between those that have to make decisions and public statements about vaccines. And an example would be the governor said that they were opening up vaccines to people 65 and older this week, and then within an hour and a half, the Department of Health said, no, we're not letting anybody sign up until February. So it sent some mixed messages, and I think what you're going to see is MEMA probably take over the coordinated efforts. And I will say this, I am extremely proud of what the National Guard has done. My wife Mary and I got our vaccines in Natchez on Tuesday. We're both over 75, so we qualified there. I'm a first responder. I qualified there, and I'm a veteran, so I qualified there also. So I didn't drop the line, in case you're wondering. I was just lucky enough to be able to get on the website to get registered for both of us. And the funny part that happened was that Mary and I swapped driver's seats so she could drive and get her shot in her left arm. And the little National Guard guy was maybe in his late 20s, and he said, "Ma'am, I'm not sure you're over 75," and it just made her day. And he said, he looked at me like I was her daddy, and I felt really, I said, "I'm not sure I like you," but he laughed about it. When he came over and I said, "Are you going to give me the shot?" And he said, "Sir, I've already given it to you, and I'm putting the Band-Aid on. That's what you're going to feel." So he was really good and very, very efficient. The Natchez operation was extremely efficient. If you got to pick a place and you're in Jackson and you can't get a shot in Jackson, I would encourage you to look at registering for the Natchez site. With that, I'm going to stop, and I could tell you a lot about what the department does. We issue about 500,000 to 600,000 licenses each year for agents and for insurance companies to operate in the state. And if you think about that, that's almost 50% of what the driver's license that are issued in the state are. And we do it without any fanfare. We just do it consistently. We regulate and we fingerprint thousands of people every year through the fire marshal's office, which I also have to run. So we've got a myriad of things that we do at the Department of Insurance that keep you healthy and keeps the state running. That includes things like elevators. We state, and we're prepared Thursday, Wednesday, if we have the inauguration and rioters in the Capitol and they come over to the Woolfolk building, we'll lock all the doors, I guess, and cut the elevators off. We can get out, we can't get in at that point, and we don't know what will happen Wednesday. We are prepared, and some things I can't talk about because my fire marshal's involved. We have bomb dogs. We've been at the state capitol. We've every 3 or 4 hours we do go around and check for bombs and several other things. And I'll tell a funny about that because we also have a cadaver dog, or used to. And when you had catastrophic events, we could take the cadaver dog out to find victims that had been hurt or injured or had lost life. And one day our bomb dog was taken to Tupelo by some of the other authorities in the state. We had to take our bomb dog over to the Capitol, and finally my chief deputy called me and said, "Commissioner, I don't know what's going on over at the Capitol, but they haven't returned." I said, "Well, check on it." And he called me back and he said, "Well, they had the cadaver dog over there, and he kept sniffing on all the legislators, thinking they were cadavers for a long time. That's why it took 8 hours to get over there." But that's kind of a funny thing you can tell. And the legislators take it in stride and laugh about it. So that's a little bit about what we do. With that, I kind of quit talking and say, I'm welcome to take any questions that you want to ask me this morning.